Hello everybody, I'm Christian Coachman and I'm here with my great friend Dr. Octavio Cintra, surgeon, specialist on orthognathic surgery, our partner here in our clinic in Sao Paulo. And with him we've been developing many of the concepts of reverse treatment planning, facially guided interdisciplinary treatment planning, and 3D digital treatment planning. We want to invite you all to come to the DSD Residency Module 1 because Octavio is going to be speaking. Octavio is also one of the main pupils from William Arnett, one of the biggest names in orthognathic surgery and airway treatments. And what I asked Octavio to do is to share with us in the DSD Residency what are the concepts that general dentists, specialists, prosthodontists, periodontists, what we need to understand about his area to be able to plan, diagnose, and interact with them to deliver more comprehensive treatments to our patients. So, Octavio, thank you very much for your friendship, for your partnership, for being part of the DSD movement, and for participating on the DSD Residency, not only in Sao Paulo. Octavio is going to fly to US and is going to be with us in New York as well at the DSD Residency in New York, sharing his knowledge. So I wanted to ask Octavio a couple of the highlights, why people should come to listen to you and to learn a little bit more about facial analysis, orthognathic surgery, airway issues.
Okay, so thank you so much, Christian. We have been working for a long time, and it's a pleasure. It's always a big pleasure to work with Christian and to talk about the DSD and the concept. Is the concept that for me was very, very important and opened my mind how to communicate my treatment plans with my patient and how to show them very objectively what's the kind of the treatment plan related to the orthognathic surgery as well. Well, my intention with these lectures is to show to the general dentists and also to the prosthodontists and to all the dentistry in the specialties how we have tools to coordinate the facially driven treatment planning, which means that most of the time the occlusion is going to show us the problem, but the facial frame, we're going to direct us how to perform the treatment plan. So we have some links and some insights to show during the lectures, during the presentations, and how the general dentist can do the visualization of this face and can perform the treatment plan based on the face, but integrating all the specialties together. And the DST and digitally, with this concept, we can connect every specialty, and so we can connect the treatment plan in a general field.
And it's going to be amazing at the DSD Residency in New York because we're going to have Bill Arnett with us and Octavio as well. William Arnett, one of the biggest names in the world, and Octavio, definitely one of the biggest names here in Brazil on this topic. And I think it's very important because I learned from you when we started 10 years ago. For me, orthognathic surgery was something extremely aggressive, only for extreme cases. And we see this huge evolution where orthognathic surgery is becoming much more precise, much more delicate, much more efficient. And as we are using here in our clinic in Brazil, something, a very important tool in our toolbox to fix facial aesthetic issues, to address sleep disorders, to be integrated with orthodontics for functional issues as well. So it's something that we believe every restorative dentist should have a basic knowledge on these possibilities.
Yeah, exactly. The general dentist, the treatment that comes from the general dentist can interfere in all the other fields. So it means that with the evolution of the orthognathic surgery, with the evolution of the technique, we can perform surgeries in patients that in the past that we couldn't imagine that would be possible. And as Christian just said, the surgical technique is improving a lot, and then we can perform surgeries in patients that can have small needles and statistical improvements with this kind of small surgeries, and then it's very precise and predictable, the results and the integration as well with the other specialties. And this is our main intention with the course and in the surgical lecture in the prosthodontist field and in the general dentistry field.
And I'm really also looking forward to the integration between what we're going to be talking with you and Arnett, integrating this with what we will see from Bill Robbins, another amazing professor that's going to be there with us, that is a restorative dentist that talks about facially driven dentistry and global diagnosis, as he mentioned. And he has a protocol of treatment planning on how to evaluate the face, mainly from the vertical perspective, and identifying the problem and combining ortho extrusion, intrusion, crown lengthening, soft tissue grafting, restorations, and orthodontic surgery. Always looking at the face as a whole and planning according to the face. What do we need to move up? What do we need to move down? And to play with these possibilities will be amazing. And beyond that, we're going to have another guest, a special guest. There's going to be Kyle Stanley from Beverly Hills, and he's going to be talking about the lip. And he's going to be talking how we can manipulate the lip in ways that we couldn't in the past. And that, together with orthodontic surgery, will make a huge impact on the way we treat. And then we're going to have another Brazilian coming as well to New York, Altamiro Flavio, that is one of the top experts in Brazil on Botox and fillers and bichectomy. So he has his own perspective of how to manipulate the face and the lip around the mouth to give us possibilities. So it's just, for me, unbelievable. I'm really looking forward to learn so much from all of you. From my restorative perspective, that a few years ago I could only change the incisal edge with my ceramics, and nowadays we can move everything around in a completely different perspective. And just to finish, one more special guest, we're going to have Oren Tapper that is going to be also at the residency, one of the top plastic surgeons in Manhattan, and he's going to go a little bit beyond the perioral environment and talk about how we can integrate smiles to faces with plastic surgery procedures. So you can imagine how much fun we're going to have only talking about this vertical perspective, analyzing, diagnosing, treatment planning, and providing our patients with amazing possibilities.
Yes, exactly. Our intention is to do a combination between the treatment plans that comes from the facial mask and the treatment plans that comes from inside, from the mouth, from the teeth, and from the jaws. And everything should be connected. And we have to do a very straightforward connection between the outside and the inside. And we used to say that in the past we started doing the combination between the frontal view from the restorative, the restorative dentistry, and with the lateral view, with the cephalometric lateral vision that was coming more developed from the orthodontic surgery and from the orthodontics. And so patient is much more than only the profile or even only the frontal view.
So these both worlds are coming together, and I think it's going to be a unique, really unique moment for me personal, for our team, and for everybody that's going to participate on this event. We want to invite you all to come. Every single piece of information we have available on our website. If you go digitalsmiledesign.com, DSD Residency Module 1, you can see the whole program. We have actually 25 guest speakers. The ones I mentioned here are only the 5 that will be talking about the face. But we have a lot about digital dentistry and how to do this plan in the computer, on the software in 3D, how the more complex the treatment gets, the more you want to test drive before you touch the patient. That's very important. That's what the digital world is bringing to us.
And how to communicate also. So
and the more complex, the more difficult to convince the patient that the treatment is good, right?
Yes.
Exactly. So you need all the help you can get to actually plan, reduce the risks, understand the prognosis, and present beautifully to the patient.
And we've been doing it for a long time, and we have much more predictable results. And then we have also afterwards how to compare how precise we were since the beginning with the projection and with the final result as well.
And we're going to have a unique opportunity there because I don't even know if you know, but Bill Arnett's is not only going to give his lecture, but he's going to give a live demonstration on the computer in 3D, how he actually plans his case and how he designs his cases in 3D in the Nemotech software platform that is integrated with DSD. So it's going to be interesting.
I just discovered after working together with Bill that after 20 years he's a computer hacker.
The guy's amazing.
Okay, so see you guys. Hope to see you. We have Sao Paulo, Madrid, New York, and Seattle, and then 4 modules in our 4 centers. So it's gonna be a big pleasure.
Take a look at the program, DSD Residency 1. Check all the content, and if you feel like coming, it's gonna be a pleasure to have you all. Besides that, we're gonna have a lot of fun as well.
Yeah, for sure. Okay.
Bye bye. See you.
See you.